Hi everyone, this is Dr. Karamachi. I wanted to quickly say hi to you and talk about blood clots and COVID. I recently got a question on YouTube about blood clots and how someone can get a test for blood clots. So if you're concerned about blood clots, usually you can get a venous Doppler. It's like an ultrasound of the legs that the doctor can get done. You can get it done as an outpatient. You can also go to the ER and get it done. There's also another test for blood clots in the lungs. It's called pulmonary embolism. You can get a CT scan angiogram for that, and that's usually done in the emergency room. So those are some of the tests that you can also do. You can also go for a blood test. It's called D-dimer, D-I-M-E-R. So D-dimer is a lab test, is a blood test, and it will show a high value if there is increased clot formation in the blood vessels. So that's something we order for all the COVID patients. If we are suspecting COVID, we go and order that. And the value usually comes high, irrespective of whether they have blood clots or not in COVID patients. So why is there a lot of concern about blood clotting in COVID? Recently, there were some reports in the news that some of the kids are having COVID toes, where they're forming clots in the toes. And whenever there's poor blood supply, there are some areas in the legs or in the fingers where you'll see some dark spots. So those are called COVID toes. The reason why blood clots can happen in COVID patients is because there's because there is increased inflammation in the blood vessels, in the lining of the blood vessels. The COVID virus can actually infect the cells that are lining the blood vessels. That's one way of inflammation. Another way is if they're in the ICU and they're really sick, then they can form what is known as cytokine storm. So that's another form of inflammation that can cause vascular problems. So because of these two reasons, there's increased formation of blood clotting, and unless these are identified quickly, whether in the ICU or in the ER, a lot of them can die just because of the blood clotting. So recently, in the journals and so forth, they're recommending providing blood thinners for all of these patients ahead of time, so that there's less chance of blood clot formation. They're also recommending if we send them home, send them on a blood thinner to prevent blood clot formation. So if you're concerned about this, then you should probably look at getting a test, or even going on a blood thinner as a prophylaxis, where you would treat any future blood clots. So that's something I would recommend as well. For a lot of our clients that go home, eventually once they recover, we put them on something called enoxaparin. It's a blood thinner. There's a lot of other blood thinners. There are pills, there are injections, and so forth that you can use to prevent blood clots. Now, if they get to a stage where they're going to cytokine storm, where there's a lot of inflammation in the body and so forth, they usually take a long time to recover in the ICU, or there's a high chance that they can die. So what we're trying to do is we're trying to avoid getting to that situation. So there's more research coming out. There are some published studies that are showing that when the researchers examined dead bodies and they looked at the capillaries, they noticed small blood clots even in capillaries. And the other thing that they noticed is in the lungs, if there's blood clotting, then the lungs are not actually getting blood, and simultaneously they're not getting enough oxygen because there's inflammation in the airway, and because their diaphragm, they may have issues with diaphragm, they may not be moving much air. So the body is not getting oxygen and the lungs are not getting enough blood supply. There's poor exchange. So that's why you need a high flow oxygen, or they have to go on a breathing machine. So these are some of my thoughts about blood clots and COVID. from all the studies so far, it seems like there's a positive correlation. There's increased blood clot formation in people who are having COVID, so that's something that has to be taken, very seriously. So in the next 1 or 2 years, we'll have more research, and we'll probably find out more about this. Meanwhile, if you notice any leg swelling, if you're noticing, your kids' toes are turning dark, or the fingertips are turning dark, then you should immediately take them to the nearest emergency room and get them checked out for any clot formation. So look forward to talking to you all again. Have a wonderful night. Thanks for being here. And if you need to reach me, you can call me or email me. You can also send me a DM. I would invite you to attend my lecture tomorrow. It's going to be on Facebook. It's around 6 p.m. It talks about lung function and how we can use energy medicine, whether to improve lung function or whether to treat any problems associated with lungs. So I would invite you to attend that, and I look to seeing you again. Have a good night. Okay.